feeling constantly tired and out of breath? Do your ankles swell up by the end of the day? Many people dismiss these as signs of getting older, but what if your heart is quietly sending an SOS? In this video, we're going to uncover the truth about heart failure, a condition that affects millions, and I'll explain why it doesn't have to be a life sentence. Hello, I'm Joban Sehmi, a consultant cardiologist in Hertfordshire, where I specialize in diagnosing a wide range of heart conditions, including heart failure, coronary artery disease, and heart rhythm disturbance. My goal is to empower you with the knowledge you need to understand your heart health. Today, we're going to talk about the most misunderstood condition in cardiology, heart failure. This term can be terrifying, and understandably so, but it does not need to be that way. Heart failure doesn't mean your heart stops. Here's what it really means. So let's start by demystifying the term heart failure. It's a phrase that causes a lot of anxiety and a lot of fear, and that is completely understandable. It doesn't mean your heart is failing or has stopped. It refers to your heart function not being normal. So think of the heart as a pump that contracts, and for various reasons, this pumping action becomes diminished or reduced. There are many reasons why this may happen, and it is my job as a cardiologist to try and understand why the heart is not working as efficiently as it should. Common reasons why the heart may be failing or may not be working at its maximum capacity include previous heart attacks, heart muscle issues. These can be inherited, issues with the heart valve, or poorly controlled blood pressure over several years. When the heart does not pump effectively, this can cause a backup of fluid. Typically, fluid builds up in the lungs or the lower extremities, can extend up to the abdomen. This backup of fluid can lead to symptoms such as breathing difficulties, particularly with exertion, difficulty lying flat, waking up in the middle of the night, acutely short of breath, and of course fluid retention in various parts of the body. Ultimately, the result is a weakened heart means that various organs within your body do not get enough oxygen, and this can manifest as a multitude of symptoms, which we will discuss next. It is crucial to understand that heart failure isn't a life sentence. This is a management journey and not an endpoint. With modern treatments and lifestyle changes, many people with heart failure live full, active lives for many years. Are you tired all the time? Your heart may be telling you something. One of the biggest challenges with heart failure is that the early symptoms can be subtle and easily confused with other conditions. The most common symptom of heart failure is shortness of breath. Typically, patients do not report breathlessness at rest. They usually feel quite well. However, any kind of exertion, such as climbing stairs or walking on an incline, easily induces breathlessness. This breathlessness will improve if you stop any activity. Patients often report difficulty lying flat and often require 2 or 3 pillows when sleeping. This happens because fluid that is accumulated in the extremities then returns to the lungs, causing congestion while asleep. Sometimes patients also report, quite concerningly, waking up in the middle of the night, really breathless, having to get out of bed, sit on the edge of the bed, or often having to get up and open the window to gasp for air. This is a very concerning symptom of heart failure and must mandate investigation. Another key symptom is persistent fatigue and weakness. This isn't just tiredness from everyday activities. This occurs because every cell in the body, every organ in the body is deprived of oxygen. When the heart cannot efficiently deliver oxygenated blood to the various parts of the body, even simple activities like climbing stairs or walking on a gentle incline induces quite significant breathing difficulties. Another more concerning and often initial symptom of heart failure is fluid retention. This starts with mild swelling of the ankles, but this can quickly progress to significant swelling of the legs, extending up to the abdomen and higher in extreme cases. You may notice that your waistline has increased weight rapidly, your shoe size has changed unexpectedly, and these are important signs not to ignore. In particular, rapid weight gain of several kilos over a period of 2 or 3 weeks is an important red flag that may indicate fluid retention related to the heart. And it's really important that these symptoms are reported and appropriately assessed. How do we find out if it is heart failure? We start with a simple test. If I suspect heart failure, and I can often get a very good idea from your symptoms and from my clinical examination, then I would like to carry out some simple investigations to confirm my diagnosis. The most important initial investigation is a blood test. I test for a specific hormone in the blood, which is called NT-proBNP. When the heart is under stress, this hormone is released as a normal response, and we can measure the level of this hormone in the blood. If it's normal, we can be reassured that you don't have heart failure. If it's elevated, then heart failure may be a possibility. Another important investigation is an ECG, which is a recording of your heart's electrical activity. That will give me an indication of your heart health, including if the heart is enlarged, is there any evidence of heart damage, potentially from a previous heart attack, is there any evidence of heart rhythm disturbance. Critical investigation for understanding if you truly have heart failure, and what I mean by this is either the heart is a bit stiff or the heart's pumping action is diminished, is an echocardiogram. This is an ultrasound examination of the heart, which allows us to directly visualize the heart in real time. We can measure the heart size. We can accurately calculate the heart's function. We give the heart a score. This is a percentage. Anything between 50 and 65% is normal. If below 50% or indeed below 40%, then this allows us to make a diagnosis of heart failure. With the preliminary investigations, if we confirm the heart function is diminished, the next important stage of the diagnostic journey is to try and understand why this has happened. And this is critical. This may be very apparent from the clinical history, any previous illnesses you may have had, any medication you're taking, your lifestyle, alcohol intake. All these are important to try and understand why heart failure has arisen. When heart failure occurs and we are not really clear why this has happened, then we have more advanced, more sophisticated imaging techniques that can allow us to make an accurate diagnosis. I may decide a cardiac MRI or a cardiac CT may be required to truly understand problems that are underpinning heart failure. And it is the identification of these problems that allow me to tailor your treatment, target the underlying cause, and ensure that your heart failure is appropriately treated, potentially reversed. If you think heart failure treatment is all about all drugs, think again. It is accurate to say that if heart failure is left untreated, the prognosis is very poor. If the appropriate treatment is not put in place, the prognosis from heart failure is worse than most cancers. But the good news is we have a multitude of medications, a multitude of treatment modalities that can reverse this awful prognosis. The mainstay of heart failure treatment can be divided into three parts. We have medication, we have device therapies, and in advanced cases, heart transplant. And I'm going to talk about each of these separately. The most important and most revolutionary progress that has occurred in the last 10 years is in the management of heart failures, and in particular, the medications that we use to treat heart failure. There are 4 drugs or drug classes that are important in the treatment of heart failure, and these are known as the 4 pillars of heart failure. The newest is a medication called Entresto. It reduces the amount of work the heart has to do and improves heart contractility. The second class of drugs are beta blockers that reduce the heart rate, allow more blood to enter the heart during each heartbeat, and increase the efficiency of heart function. Dapagliflozin is the new wonder drug, that was used to treat diabetes. This improves fluid retention and also improves metabolism within the heart muscle, improving heart efficiency. The last pillar of heart failure therapy is an aldosterone antagonist, and this reduces the amount of work the heart has to do, has a beneficial effect on the right side of the heart, and also helps with fluid retention. Taken together, these drugs have a synergistic effect, so they all work together to improve your heart health, stabilize heart failure symptoms, make you live longer. Device therapy is another important intervention in heart failure. The first one is CRT. So in heart failure, the right and left sides of the heart are doing different things. A CRT device allows us to put 3 wires within the heart, and using a pacemaker, we can resynchronize the heart. So in heart failure, the right and left sides are doing this. Once the device is in, the right and left sides of the heart contract together, and this improves the heart's efficiency, improves exercise tolerance, and we know it also makes you live longer. In patients who are not suitable for this particular type of device, we have the option of implanting an ICD, which is a shock box. So one of the major concerns with heart failure is that there's a risk of the heart becoming irritated and generating really rapid, fast heart rhythms. The shock box has the ability to identify these, to detect them, and to shock you out of this fast heart rhythm if required. In patients who have been treated on maximum medication, have been given these devices and still continue to deteriorate, in certain selective patients, the option of heart transplant is available. Another important point to make about heart failure treatment, and probably in my opinion, the most important intervention in the last 10 to 20 years of heart failure treatment, is the advent of heart failure nurses. Every patient with heart failure will be allocated a heart failure nurse who has the ability to see patients far more frequently than is possible with me. They will see patients regularly, check their blood tests, ensure that there are no complications from the medication. If side effects arise, they can deal with them by reducing the dose of medications and all providing psychological support. Lastly, in patients who are reaching end of life despite all these interventions, then we work very closely with our palliative care colleagues who are experts at symptom management and addressing important complications as they arise. The key is a personalized approach. We find the right combination of treatments to give you the best quality of life. Some patients need all 4 medication classes, others need fewer. It depends on your specific situation. Here's how your daily habits can be your most powerful tool against heart failure. Novel medications to manage heart failure, novel devices to improve heart function and protect against fast heart rhythms. Lifestyle is also an important tool in your armory against heart failure. It is really important to monitor your fluid intake and also important to be vigilant of your weight. In patients with significant heart failure, we advise a degree of fluid restriction, typically 1.5 liters, and this involves all types of clear fluid, teas, coffees, soft drinks, etc. If your weight increases suddenly and unexpectedly, this may indicate an important change in your heart health. Consider this a red flag, and it is important that you get yourself checked out should this situation arise. Adhering to a low salt diet is also important. Salt has the ability to retain fluid, so if your diet has excessive salt, this can lead to unwanted fluid retention. It is really important that you ensure that your salt intake is less than 2 grams a day. It's really vital that you look at food labels very carefully to ascertain salt content of food and veer towards more low salt products. Exercise is critically important in heart failure. In patients with extremely weak hearts, it may seem counterintuitive to exercise more because it may induce more symptoms, but the benefits of exercise are equivalent to any medication. Gentle exercise improves your overall fitness, improves your blood pressure, allows you to maintain a healthy weight. Light weights can allow you to increase your muscle mass, and we know all of these are correlated with longevity and an improved prognosis. It is also important to remain vigilant of other important factors that can influence your cardiovascular health. It's important that you abstain from smoking, do not drink alcohol in excess, ideally avoid, make good dietary choices, and maintain a healthy weight. These lifestyle changes empower you to take control of your health and partner with your cardiologist to manage your condition successfully. To book a consultation with me, you can go to the link in my bio.